Hi.
Good evening. I'm a fill-in for somebody who was here a couple weeks ago and there was a miss on where to go. So I'm your substitute. I'll try to do well. I heard a cute story today, so I want to tell you because I got a laugh out of it. This from a patient told me. Shouldn't offend anyone. It's just meant to be fun. A cab driver and a preacher both die and end up in St. Peter's Court in line. And the cab driver's in front and the preacher is behind him. And when the cab driver arrives to St. Peter, he says, the cab driver's watching what's going on, or the preacher's watching the cab driver. And St. Peter blesses him and he gives him a staff with a great gold shield on it, and it's decorated in diamonds and rubies, and it's beautiful. And then he's ushered out. And so the cab driver's thinking to himself, boy, when I get there, I'm going to really get something good. Because he's just a cab driver. And so the cab driver, or the preacher, gets to St. Peter, and St. Peter very quickly just hands him kind of a wooden cane that's kind of beat up and doesn't look very good, and hands it to the preacher. And the preacher says, like, look what you gave the cab driver, and what about me? I mean, why am I getting this? And so St. Peter said, well, when you preach, they sleep. When he drives, they pray. Oh, good, you laughed. All right. I did too. All right, so heart disease. My grandfather died of heart disease. My father died of heart disease. My brother has had stents and then bypasses, and this is a major problem in the United States. Like, it's the biggest killer. It's usually silent. Many people with heart disease find out the first time when what occurs? They die. Okay? The most frequent sign of asymptomatic heart disease is sudden death. Okay? It's a heart attack and sudden death. It isn't predictable very well by a regular physical examination, a cardiogram. A stress test is better, but not necessarily. And so, since this is sort of an epidemic, because in the early 1900s, heart disease killed very few people. This is a new phenomenon, okay? Now, there has been a lot of research and a lot of work done to try to find out what is the thing that has caused this epidemic, where many people are getting clogged up arteries and getting heart disease. The most successful model to date is that artery disease is caused by cholesterol buildup, caused by a diet too high in cholesterol, which then clogs up the arteries, and the savior for that is that you take a statin drug. In fact, it's almost a sort of code of ethics of most medical practitioners that no one should be without a statin drug. It's starting to be given to children. Okay? The problem with this is that statin drugs have not prolonged lifestyle or life expectancy. That in females over 60, they don't work at all. In fact, if you have high cholesterol and you're a female over 60, you're likely to live longer than someone with low cholesterol. That you have to treat 100 people, 100 males, to get one that actually lives longer with the drug. But the drugs are very successful. They sell tens of billions of dollars per year. They do have mild anti-inflammatory effects, which may be somewhat helpful under some circumstances. But they damage a key enzyme that works in every cell in the body. They block that enzyme. And it's an enzyme that allows your body to make a substance called CoQ10, which is a key nutrient that every cell in the body needs in order to make energy. And so the downside of this medication is that people who are on these drugs get Alzheimer's more frequently, often show signs of liver disease and muscle disease, and generally the incidence of cancer, especially liver cancer, is higher. So on balance, I find in my practice that these drugs aren't really what's wrong, because a person with heart disease or blocked arteries doesn't have a deficiency of a statin drug. They do have a problem, and that when we investigate this, we can usually figure out what are those factors that lead the person or the body down this path. And that's what I want to talk to you about tonight. The sort of cut to the chase bottom line is that inflammation occurs in blood vessels. Now, what's inflammation?
Getting red.
Yeah, when things get inflamed, like I have a new puppy at home, and I have a scratch here on my hand, and it's red and swollen. He's got little razor sharp teeth, and I'm wising up on it, but the first couple of days, he got me pretty good. And this is inflamed. It's red, it's swollen, it's painful, and those are the sort of the classic signs of inflammation. And what we see, if you take a blood vessel that is blocked, is we see that there is inflammation going on in the inner wall of that blood vessel. And so when you have a blood vessel that looks like this, and it gets inflamed, then this inflammation narrows the path whereby which blood can go. And when that path is narrowed, then blood can't go through. Sometimes the inflammation areas have little sort of plaques. They have little sort of cholesterol plaques, and these can break off. And then when it goes to a small blood vessel, the plaque can block the blood vessel. And that results in, if the blood's going here and here's the heart, or here's the brain, that if this blood doesn't get there, then you get muscle that doesn't get blood, or brain that doesn't get blood. And if you just take a tourniquet and put it on your arm and then start going like this, in a few minutes your hand won't get any blood, it'll go numb, and then if it still doesn't get any blood, it'll start to hurt, and if it still doesn't get any blood, the cells start to die. And so a heart attack is dead or dying muscle cells in the heart. In the brain, it's dead or dying brain cells, which would be a stroke, one kind of a stroke. So, but the origination of this is that there's inflammation, okay? Now, the key question then would be, why are we inflamed? Why are we inflamed? And so, one of the biggest culprits is a hormone that's within our body called insulin. Now, the job of insulin is this. If you eat something that is a protein or a carbohydrate, as soon as it touches your tongue and the body gets a signal, the body sends a message to the pancreas to release this hormone called insulin into the bloodstream. And that hormone goes into the bloodstream and goes to every cell. So let's pretend here's a blood vessel. I'm going to call this S. This is a sugar molecule, like a glucose molecule. And this could be from fruit, or from a piece of bread, or from a pancake, or from, say, some whey protein. Okay? Because a lot of the proteins break down into sugars. And here is a cell here that needs this sugar in order to live. And there's a door here where so the sugar goes out of the blood, it goes toward this cell, and here's a door, it can't get through that door unless, here's insulin. Insulin comes out first, opens the door. And then when the door is open, the sugar can go in, and the cell uses the sugar to make energy. And that's how it's supposed to work. Now, what happens with people is that if there's too much sugar in the diet in any form, pretty soon the cell starts to refuse to open the door when the insulin comes. Because the cell says, I am full. I can't take any more sugar. I don't know what to do with it. I'm stuffed. And I'm refusing to take any more sugar. And I'm not going to open the door. And what does the body do then? The body says, I'm going to send more insulin. And more insulin. And more insulin. I'm going to knock on that door till you open. Okay? And this is what type 2 diabetes is. Diabetes is someone who generally has a very high level of insulin. The body keeps raising the insulin. So a healthy fasting person, okay, I just had this done last week, measured my insulin level in a fasting state. It should be less than 5. Okay, mine was 2.9. So that was good. A lot of people are walking around with 7s, 10s, 25s. The insulin level never went down because the pancreas is pumping out so much to try to get these cells to take it. And the cells aren't taking it, and the brain doesn't want high sugar in the blood. Because high sugar in the blood causes inflammation. And high insulin also causes inflammation. You get this 2 double whammy. So if your waistline is bigger than it was when you graduated high school, you probably have a high fasting insulin, and probably this is going on in your body, and there is inflammation as a result of this. And this was way, way less true in the early 1900s and through most of the 1900s when sugar and processed stuff and stuff, it just wasn't available. You know, people basically ate regular whole foods, and it wasn't all packaged, and it wasn't all processed, it wasn't all full of sugars, and they did way better. The incidence of heart disease was way less. Incidence of cancer was way less. Okay? So now it's a whole new ballgame because there's way too much food available, and it's too easy to get, and it's too hard to turn down. Okay? So this is one of the main culprits. And so your waistline is an index of your insulin. For many people, this isn't 100%, but for many people. Okay? There are some thin diabetics, but generally, people who have type 2 diabetes, they have high body fat inside, visceral fat we call it, and they have excess body fat. They have a high fasting insulin, and they have a high fasting sugar. And all the medications that are used for type 2 diabetes, in order to coax this cell to take more sugar and lower the blood sugar, every one of them increases the amount of inflammation in the body and increases the chance that you're going to have a heart attack. So while the doctor says you're doing good, your blood sugar's down on diabinase or whatever drug you want, if you look at those people that take those medications long term, they have a more rapid rate of heart disease and blocked arteries than people who don't take the drug. So it's not a very good solution. Okay? So that's kind of a main culprit in inflammation and in causing heart disease. And so one of the standard tests we do on every new person is, what's your fasting insulin? Because that's an index of what is happening in the way of inflammation. Yeah?
I don't know really anything about diabetes, but I've heard that people with diabetes often need insulin shots. Is that another type of diabetes?
Well, if the body burns out and can't make any more insulin, then the diabetic turns from a type 2, which means they're making insulin and the levels are high, but their sugar is still high, into a type 1, which is the pancreas is now burned out. It's so tired or it's so injured that it doesn't make insulin.
Okay.
And so then you have to give someone insulin.
So is that a more advanced stage than?
It's a worse stage.
Okay.
It's a more advanced stage. So most adults don't get to that stage. Sometimes children have a virus infection or something of their pancreas, and it kills the cells in the pancreas that make the insulin, and they don't have any insulin. And they have diabetes, and they have to take insulin. So in those cases, that isn't this disease.
Right.
Those cases, if the right amount of insulin is given, so that the blood sugar is in good range, they don't get inflammation from it. They can live pretty much normal lives. Okay? Diabetes is a model for this because the incidence of heart disease in diabetes is very high. Okay? And the secondary complications. Okay? So they get eye disease, they get kidney disease, they get circulation disease, the blood vessels in the feet and in the legs. This is all, as these blood vessels get inflamed and this isn't controlled, then this disease process could go on in other places besides the heart. Okay? We're talking about heart disease, so I'm going to mainly stay on it. Now, there are a bunch of other things that can cause inflammation that are identifiable besides what you're eating and what your insulin level is. And I want to talk about those for a bit also. So we have number 1 is insulin. And a reasonable guide to this is your fasting blood sugar. If your fasting blood sugar is in the 80 to 90 range, that's really good, and the most likely thing is that your fasting insulin is going to be low. If your fasting blood sugar is 115 to 120, then most likely that you're on this path. Now, this truly isn't a disease in the sense of you've got contagious something that you can't get rid of. It's really a condition that all your body is telling you is, I can't survive with what you're putting in my mouth. It comes down to that. There's no diabetics came out of the concentration camp, okay? Or in people who are sort of semi in starved conditions where their calorie intake is very low. They just don't get this stuff because this process doesn't go on, okay? There is a molecule called homocysteine. And homocysteine is an amino acid. An amino acid, biochemically, is some carbons and hydrogens with some nitrogen on it. And about 1 in 4 people, when we measure their blood, have a homocysteine that's too high. And this may be genetic. And genetically, the body is supposed to remove this stuff using a process, which if you've been following this, called methylation. A methyl is a carbon with 3 hydrogens, and this the body uses as a kind of a switch. It'll stick this on to turn something off, or it'll pull it off something and it'll turn it back on. This is a switch. And about 1 in 4 of us have a problem with this, and when this isn't working, this goes up. There are very few cardiologists who check anybody for homocysteine, but it is way better marker for problems with heart disease than cholesterol is. The problem with cholesterol as a marker is that half the people who have heart disease have normal cholesterol. So as a thing of like, this is the problem, it just doesn't work out. But this one's much better. This is in my family too. So homocysteine is a problem, and it is controllable by making sure that you get enough of these things. And so we put people on supplements for this, which are called methylation things. It's B12 and folic acid and B5 and B6. These are B vitamins. These people need high doses of B vitamins. And then when they do, the homocysteine goes down, and then they're okay. And then, since there is no high homocysteine, there is no inflammation. Okay? So, this should be on a standard panel, as the doctor does when you go every year, starting at age 30 or 35. Like, check my blood once a year. What's going on? How's my fasting insulin? How's my homocysteine? And then along with insulin, same thing. Hemoglobin A1C, this is a measure of how much sugar has actually been in your blood the whole time. So that should be measured as well with fasting sugar.
heard the word panel a lot. What does panel mean clinically?
Well, panel is just the items that the doctor orders. And so there's our set panels. There's a diabetic panel or a heart disease panel. And it just has, like a panel that I've got, has all this stuff in it. Because when I'm coming in with a new person, I don't know what they've got and what they don't have. And if I look at this in 30 seconds, I can tell them, look, your insulin's high, your fasting sugar's high, your hemoglobin A1C's high. You're going down this road. You're on the train, it's headed for the wall, and this process of inflammation is going on in your body. Is it going to give you cancer? Is it going to give you a stroke? Is it going to give you a heart attack? You may make it to 75 or 80 without that, but you may not. But these things are all modifiable. They're all changeable. You can get off the train. You can turn the train around. One of the biggest factors, I had someone come in last week. She's a gal who lives in Denver, and she had been to her doctor, and her doctor told her that she had that she was very much in jeopardy for getting heart disease, and her cholesterol was just borderline. It wasn't really very high at all. But she had another thing, which is another measure of inflammation, called CRP, high sensitivity CRP, and this should be on the panel. And it's a marker for inflammation in blood vessels, and it should be less than 1. In the laboratory, it says 1 to 3 is normal, and above 3 is bad, but it really should be under 1. And it's a measure of how much inflammation is going on in the blood vessels at any given time. And she had a CRP that was 4. And remember, we wanted less than 1. And so her doctor said, you're set up for heart disease, get on this cholesterol medicine right away. This is like an emergency. And she was all distraught about it and all upset, and she didn't want to go on medication. Excuse me, she didn't have any symptoms. And when I started to check her over, I found that she had significant gingival inflammation. So gingiva are the gums where they meet the teeth. And when I looked carefully at her gums were a little bit swollen, they were a little bit irritated. I'm not a dentist, but if she would have gone to the dentist, there would be some pockets in there. She had a couple of teeth that had been root canal treated, and those tested as that there was inflammation coming out of there. And this is a very common source. You know, you could talk to a cardiologist and they say, well, how does this inflammation in the heart artery get started? Well, we know it's associated with dental things, you know, with cavities and gingival disease. And it is, because those gums are swollen, those blood vessels are open, and there are bacteria and funguses and parasites in those areas. And those things jump in the bloodstream, and they go to the heart, or they go to the blood vessels, and they cause inflammation. Okay? So handling your dental situation is a huge factor in reducing your inflammation. So you go to the dentist every 3 months, you get it checked out, you brush your teeth twice a day, you floss every day, you know, you get a handling for it so that you repair your mouth. And if you have root canal teeth that aren't any good, you get them fixed, get them out, because they're a big source of inflammation. Okay? The other one here is, I'm just going to put it under gut. Now your gut is really thought of as your small intestine and your large intestine. So you eat some food, goes through your esophagus, goes through your stomach, goes into your small intestine for like 25 feet. And in the small intestine, the food is digested and it's absorbed, and then the waste goes into the colon. The colon's maybe 8 feet, and then the purpose of the colon is to dehydrate the stool so that you don't have diarrhea all the time, and you get a formed stool, and it can come out. In the colon, if you took a really fine microscope and you set someone on the task of how many cells are actually in your body, how many cells make up your body, it's about 150 trillion cells. Okay, well, that's a big number. Trillion is How many zeros?
Well,
Yeah. 150. 1, 2, 3, that's 1,000. That's million. That's billion. That's trillion. That's the cells of our body itself. We have 2 times that number of bacteria in our intestine. 300 trillion. Now they all fit in there because they're small. Okay? So a bacteria is way smaller than one of our cells. And those bacteria can be friendly to us or they can be unfriendly to us. Because that's a huge number of guys and gals, or its, I don't know, they're more like its, that they eat, they pee, they poop, they make toxins, they're in us, the stuff comes in us, they have a huge influence on us. And so one of the routine things I do is I get a poop test on people. What's happening in your gut? Okay? Do you have friendly bacteria there? Or do you have a lot of unfriendly bacteria there? Do you have parasites there? Do you have funguses growing in there? You know, what's the makeup? And I had somebody last year who came, and when we did the original panel, her CRP is 25. That is really high. Like, she is at very high risk for bad stuff. And her teeth were good. So I did a poop test on her. And she had a lot of bad bacteria growing in her intestines and some parasites. And when we fixed her gut, her parasites and her bad bacteria, and recolonized her with good bacteria, her CRP went to 1.5 in about 8 months. Okay? Now that's big. I mean, that is changing the course of a body, like, really effectively. And she could feel the difference. Her joints stopped hurting, her muscles stopped hurting, her energy got better, she could think clearer. All these things are affected by inflammation. So if the inflammation is affecting your joints, you're going to hurt. If it's affecting your muscles, you're going to hurt. If it's affecting your brain, you're going to maybe not think as fast, you may be foggy, you may not be alert, you may not be able to sleep, you may have crazy thoughts. You know, it could affect a person in all these different ways. And so reducing inflammation is really, it's what a good lifestyle is intended to do, is reduce inflammation. Okay? So the gut is really important. There are a lot of people now, because they're taking medication to block acid from being produced in the stomach. Okay? So here's how it goes. A person's eating food that doesn't agree with them. Okay? It's either processed, or they're allergic to it, or it's toxic itself. And their body doesn't like it. And it gets inflamed because it's mad. It's like, this is not okay. Okay? And they burp up acid, and they get heartburn, and they get bloated, and they go to the gastroenterologist. The gastroenterologist says, let's scope you. They scope you, and they see, well, there's a little irritation in your esophagus. I don't see a big ulcer in there. But the cure for this is take X medication, Nexium, Tagamet, Pepcid, Acifex, name one, and you'll be fine. And don't look in the PDR at the fine print, because it says in there that you should never take these drugs for more than 2 or 3 weeks, because as emergency measures, sometimes they are very good. You got a big bleeding ulcer in there, and you got to turn the thing off, so that turn the acid off so it doesn't keep burning. These drugs can be effective. Okay? But after a few weeks, they're very damaging. Because now the person has no stomach acid. And without stomach acid, how do you think, who here boils all their food and sterilizes it before they eat? No. When you just bite your fingernail, pick something out of your teeth, eat some salad, you know, eat anything, there's bacteria in there, and there's funguses in there, and there's probably parasites in there. And you know the body's main defense is when that stuff gets in your stomach, the acid in your stomach boils that stuff and kills it. It's like an acid bath, like a pH super acid bath that kills it. And if the acid bath is blocked by a drug, it doesn't kill it. Or if you're over 40 and your nutrition's borderline, chances are you don't have stomach acid. You're just zinc deficient, or you're copper deficient, or you're amino acid deficient, and your body just doesn't make it. And so you're at risk, because then those bacteria and funguses and things can go in there, and they may colonize your large intestine, but too often now what we're seeing is that they colonize the small intestine. It's called SIBO, small intestinal bacterial overgrowth. Your small intestine's not supposed to have bacteria in it. A lot of bad breath is SIBO. It's fermenting organisms in the high intestine that produce rancid gases that when you breathe, or you know, that because they bubble up through, that can make your breath smell bad. It isn't even that you didn't brush your teeth or that your oral hygiene is bad. I mean, sometimes that occurs too, but that this is more a small intestine problem. Okay? And again, this has to be cleaned up so that the person then, the inflammation will reduce. So that's really important. Okay? One of the other things in this, which is really important, is metals. Heavy metals. Mercury, arsenic, lead, cadmium, all these metals, aluminum, we are surrounded by these. They come into our bodies every day. They're everywhere. Okay? They're in our food. They're everywhere. And they get into us. And we tend to accumulate them. And they are sources of inflammation. Okay? These metals, all these things with inflammation are what we call free radicals. A free radical is a molecule that's got a positive charge and he's unstable. You know, when I grew up in the 60s, the Students for a Democratic Society were called radical groups because they were like riled up and they were going to cause trouble and cause damage. Okay? And so that's what these free radicals do. Now, pesticides are free radicals, and dioxins and chemicals are free radicals, and heavy metals are free radicals. They are particles that have a positive charge, and they cause damage because when this particle gets in a blood vessel, and you have this little innocent cell sitting here lining the blood vessel, he's going to grab an electron, a minus charge, so that he can calm down. His fix to settle down and reduce his positive charge is to steal an electron from someone else. And when he does that, he leaves this guy damaged. And that starts the inflammation process. Because now you have a cell that's had an electron ripped off its surface. And the immune system sees that and it goes in there to try to do something. Now that can happen with a bacterial infection, it can happen with chemicals, or pesticides, or heavy metals. And so we always, as part of our sort of look at people is, how's your blood level of heavy metals? And it's fairly, I mean, almost everybody, what we're seeing today is lots of people have cadmium. Almost everybody has high lead. Okay? Arsenic's very common. Arsenic's used as a pesticide, it's all over the place. Lead is everywhere. We're all lead toxic. A Harvard professor did a study on lead. And lead is very close to calcium in terms of how it behaves. And so oftentimes when lead comes into the body, in order to sort of get rid of it or hide it, will put it into bones to kind of like get it out of the main traffic because it's poisonous to cells. And so you can evaluate how much lead is in someone's bones by taking a special kind of x-ray. And the x-ray will tell you the lead concentration. So he took, I think, 500 or 1,000 people, average people, 40 to 60 years old. He did an x-ray of their forearm, and he measured how much lead was there. And then he took 500 cadaver bones from 500 years ago and measured how much lead was in their bones. And what he found is that the lead level in our bones versus the lead level in the bones of people 500 years ago was 1,000 times higher. Okay? When automobiles started to be driven in this country in about 1910, the gasoline was leaded. And leaded gasoline was in use till about the early 60s. And the whole countryside worldwide was saturated with lead. Because when you burn lead, gasoline, the lead comes off. And I've had a few patients who were champion either NASCAR drivers or motorcycle, cyclocross guys, and they're 20, 21 years old. They're all lead toxic because they were using leaded gasoline in those machines because lead is a performance additive, and they're breathing those fumes, and they're on the track every day, and they're super lead toxic. Okay? So these metals are in every one of us. And if you got a really good body, you're able to handle it or detoxify it. For most of us, we've got to do something to get them out because they accumulate and they don't leave very fast. And unless you put in specific things to bind those lead and mercury and arsenic, and you know what the newest one is? What's the newest heavy metal that now we're seeing in everyone just go like this? Who can tell me?
Mercury?
No, mercury's a good old friend for a long time.
Uranium.
What's the new one?
Uranium.
Uranium. Okay? This Fukushima thing is not over. It's a massive, massive problem for Pacific fish, for Pacific algae, for plants. And in California, they had to raise the level of safe levels of radiation by like 2x because the fallout that's coming off of that thing and blowing this way is high. And we are seeing in our patients, when we do a heavy metal challenge, that more than 50% of them have high uranium levels now, coming out of their urine when we challenge them with something that will bind the metals. Okay? Very, very, very scary, really. Okay? Tina?
Is the lead one of the culprits for a brain tumor?
It's a culprit for lots of things. Lead is cancerous. It will cause cancer, okay? It causes anemia. It causes mental retardation. A lot of children routinely, especially in the Northeast, they're screened for lead levels when they're 5 years old because there's a lot of old lead paint, and these children get exposed to it, and it reduces IQ. It causes retardation. These heavy metals are a very, very interesting thing. Another guy did a study. He went to maximum security prisons, guys who are on death row. So that was one category. So these are guys who are on death row, like completely as antisocial as you could get. Whatever they did something horrible. So that's one category. And then the next category is guys who had life sentences, but they weren't on death row. And the next category is guys who were sort of white-collar criminals. They stole some money, they fudged their bank account, they avoided the IRS, something. So they didn't really go after anybody. They weren't sociopathic in a sense, okay? And what he found is that the heavy metal level in the hair of these massively terrible criminals was the very highest. And the next level of criminal was lower, and the next level was lower. Now this is incredibly interesting. That you aren't completely crazy on your own. You might have a tendency, and that isn't to say that there aren't some crazy people, okay? There are. But if you just look at groups, it's very interesting that this group was poisoned. They were just like poisoned, major, significantly poisoned with manganese and lead and these other toxic stuff. And it messed with them. Okay? So these aren't good things for anybody. And they have to be dealt with. Okay? So part of the things that we look for are that. So these are probably the sort of major players on the toxic side. And then we have to look at the other side, which is sort of on the deficiency side. Like if you're missing some things that should be there, your body's not going to operate right to either handle inflammation or handle heavy metals or detoxify you. And so the sort of four major things that everybody has to have, the four major things that you have to get in through your diet is adequate vitamins and adequate minerals and adequate amino acids. These are things that get made into proteins, and adequate essential fats. And so I always do a panel on someone of like, where are you at there? Are your omega-3 fats low? Are your omega-6 fats high? These things lead to inflammation. Is your vitamin D low? Leads to inflammation. You know, do you have low zinc, low selenium? These are all factors in this thing. Do you have enough amino acids? If your amino acid levels are low, you won't detoxify. So the other part of this is deficiency, and the other part of this is hormonal, what's happening. So we all have these hormones that are supposed to balance inflammation versus no inflammation. Okay? So one of the most significant ones is called cortisol. Okay? Now virtually, probably 80% of people who walk into, say, a nutritionist or a chiropractor's office will be diagnosed as your adrenals are stressed, you have adrenal fatigue. It's very common, and it's true. And one of the major hormones that the adrenal gland makes is cortisol, hydrocortisol, same thing. And when your body turns on inflammation, once the process has reached the point where it's done what it should do, cortisol then should go to there and turn it off. So you fall off your bike, you bruise your arm, inflammation, okay? And in a week or two, the inflammation should have cleaned up the area, the cortisol comes in, the inflammation goes down, the arm heals, and it's done. But what happens if you do that and the inflammation, the cortisol level's too low? Your body can't make it. Well, then the inflammation isn't going away. It's gonna hurt, and it's gonna hurt, and it's gonna hurt, and now it's 3 months later, and it's still hurting. Doctor, why is my arm still hurting? I bumped it 3 weeks ago. It's still hurting. Well, let's look at your cortisol level, and among other things. Well, your cortisol level looks like you don't have any. So this is another factor in this thing. And most people today are stressed out to the hilt, and their cortisol levels are challenged. So if you're stressed, it doesn't matter if it's your wife or your husband or your boss or you run marathons. If you've got too much going on that your body can deal with, then your adrenal glands may get tired. And if they get tired and they can't make the hormones that support you when you're stressed, then you're going to have trouble. Okay? Now, so what do we do with this? Like, how do you, like, so you're sitting here and like, okay, almost everyone has some of this going on. In fact, everyone has a lot of this going on. We all do. And so how can you modify your lifestyle and your habits so that you can survive in this challenging environment? That's what it comes down to. So food's really important. You want food. Well, like, what are you going to eat? I find that a place to start is go on a paleo diet. Don't do grains, don't do dairy, don't do processed foods. If it comes in a box or a package, don't eat it. Eat real food, as organic as you can afford. Fruits, vegetables, nuts, seeds, meat, fish, eggs. That's the palate. Okay? And for most people, after 3 or 4 weeks, once they get used to it and they figure out how to do it, their body will do better. It's basically a low inflammation diet. Okay? And for most people, their gut will settle down. Their gas will be better, their acid reflux will be better, their bowel movements will be better, they will be better. I had an office manager, she's not with us any longer, but she was probably late 40s, and she had been constipated ever since she could remember as a kid. And you know, when we put her on a paleo diet, her constipation went away within about 10 days. She was taking like 30 different kinds of things to get herself to go to the bathroom every day, because she just couldn't go. And once she got dairy and grains out of her diet, she started to go. I've seen it over and over and over again. Okay? So it's a place to start. Doesn't work 100%, but it's a place to start. Sometimes we have to do food panels on people because sometimes they're eating foods and they're really sensitive to those foods, and you wouldn't know it. You know, they can't tell, and the reaction they get is 3 days later, so they can't tell, and I can't tell. And we do a food panel, and I find, oh look, here's a list. You know, blueberries and almonds and garlic and peppers, boy, you got to avoid these for a while because they are causing inflammation in your body. Okay, so food's an easy place to start, and you can do that on your own. You don't need anybody for that. The second thing is every year at least, sometimes more often, I get one of these panels. Like, what's happening? How are my vitamins, minerals, amino acids? How's my homocysteine? How's my CRP? How's my fasting insulin? How's my hemoglobin A1C? Where am I at? And I'll tell you, it's always interesting. Why is that? You know, like, why is that up? What's changed? Okay? But then you get it. You know, you don't have to find out when you've got a heart attack that you should have done something 5 years ago. It's like silly. Okay? So you spend a couple $1,000s, okay? And you do this, you just save your money. Insurance won't cover this stuff, most of it. Some of it they do, but most of it they don't cover. It's just like this is sort of your responsibility for yourself. A Starbucks coffee is $4 or $5. No one here would deny themselves a Starbucks coffee. Multiple times a week. Okay? Some of you don't drink it, I know. But I'm just talking sort of in a general sense. So, and I don't say that you shouldn't ever drink Starbucks coffee, okay? It's just the idea, you know, the idea of where are you gonna, what's important, just health-wise. And so you just have, there's no other way to find out, okay? Now there are people who do various kinds of energetic testing, muscle testing, all this stuff, it's all great, but you won't find it, okay? You just won't find it. Because this is sort of basic chemical biochemistry. And if someone comes into my office and they say, well, my chiropractor muscle tested me and he said, I don't need vitamin D. Horse manure. You know, it's just like horse manure. Like, let's see what your vitamin D is. And if it's 60, good, he was right. But if you're not getting a lot of sunshine and you're not taking vitamin D, I can bet you any amount of money that you want that your vitamin D is below 30, and it's a major cause of inflammation and heart disease. And the fact that it didn't muscle test isn't anything against the muscle test, it's just a stupid way to try to evaluate something that you can just get a simple test for and you can find out. Okay? So I think this is, as a part of looking and doing an evaluation, is what is going on with this stuff? Do you have high heavy metals? What shape are your teeth in? So that you can modify every one of these things. Now, we get a lot of people who are sort of down the line from that, and they come in and they have a problem. You know, they had a heart attack, or they had a stroke, or their circulation isn't good, or they got stents put in, or they got bypasses, or they're getting chest pain, or their father did, and now they're getting to that age and they're worried about it and they want to find out. Well, absolutely, find out. How do you find out? You look at stuff. We have a new device that we just got in the clinic, which in 3 minutes, you put your finger in the little thing and it takes your pulse. And it does a very intricate analysis that will tell you how flexible are your blood vessels. Now, when you're young, they're just like rubbery, they're just like stretch and they're just like happy, and they just, you know, when the heart pumps, they go like this, and then they go like that, and the blood gets squeezed down. And when they squeeze down, the blood all is emptied out, and they're just like a young kid. They're just like bendable, and they just go. But as that inflammation starts to develop in those arteries, and they start to swell, and the plaque develops in there, and then it calcifies, those arteries get stiff and will move. And this thing can tell us on a 1 to 7, where are you? How stiff are your arteries? How well is your system working? How down the line are you? And we get somebody who's a 4 or 5 or 6, they're in trouble. And you get somebody who's a 1 or a 2, their artery health is way better. Okay? It's a simple little thing, $25. You know, how is your artery health? So it's worth doing. So those are things worth doing. Now, we do a lot of things that we can help people and fix them. Okay? So we can give them things to chelate these metals that get stuck in their arteries and pull them out and reduce inflammation. It's called chelation therapy. Okay? You sit for about 35 minutes and you get an IV and the stuff runs in there and it binds up the metals, the aluminum, the arsenic, and the mercury, and the cadmium, and the uranium, and you pee it out. And you start to lower your load. 30, 40 of those, and your load will be way down compared to where it was before. And we give you some supplements to take at the same time, so it's working even when you're not getting it, and it makes a big difference. Okay? People feel brighter, their bodies work better. You just get these poisons at a lower level. Nobody's going to go to zero, but the poisons are at a lower level, and your body will function better. That's easy. We have another relatively new treatment, which is called Plaquex. Now, the cells in our body have a membrane. So here's a cell. Doesn't matter. Brain cell, liver cell, kidney cell, doesn't matter. And that membrane, by the way, this is the door to insulin is in that membrane. I'm writing it as a door. I don't think it's a door that swings like this. It just is like it opens and closes. Okay? This membrane is mostly made up of a substance called phosphatidylcholine. It's a phospholipid. It's a phosphorus plus a fat. And this membrane is a mixture of phospholipids. And as we age, those lipids leak out, and the bad cholesterol, LDL, is mostly these guys that have leaked out because the cells are sick when that goes out. And somebody figured out that if you gave phosphatidylcholine intravenously, about 30 treatments, that the LDL goes way down, the membranes now fill up with new, good, pure phosphatidylcholine, and all the cells work better. You'll think better, you'll sleep better, your cells will be better, and when we do the study on the elasticity of your arteries, the elasticity of your arteries gets better because they're now more flexible. Okay? So this is a really good thing. For a long time it wasn't legal in the U.S. It's now legal, and so we're doing it, and it's wonderful because you can reverse processes.
5 minutes.
Huh?
5
5 more minutes? Okay, good. Okay, so we have chelation. The other thing that I always add in this mix is we use a lot of ozone, which is oxygen to the third power. So the oxygen we breathe is O2. If we take O2 and we run it through a little bit of an electrical chamber, we turn it into O3. Now you've probably all seen ozone used in air freshener systems. Why does it work? Well, ozone has a great big monster negative charge on it. And when it runs into a metal with a positive charge, or a pesticide, or an odor, or something with a positive charge, it binds it and it takes it out. It's like a sweeper. So it goes through your body and it binds all this stuff. It sweeps chemicals, pesticides, heavy metals. It sweeps them. Okay? And then also the oxygen goes into your cells and livens them up. And also, if you've got bacteria that are wandering around in your bloodstream, or parasites, when they see this stuff, they get vaporized in a second. Okay? One molecule of ozone will kill 4,500 bacteria in unmeasurable time. It's like, bam, done. If you use bleach, it takes many, many minutes. Okay, so it's very powerful to disinfect and to clean up. So we give people ozone. So we do chelation with ozone. We do Plaquex with ozone. We do these various things, and it gets people, it helps their bodies. Yeah.
My dentist uses ozone.
Sure, same reason.
It helps heal after, crowns or fairly heavy work. He'll use ozone to help heal the tissue. And I got some persistent bleeding gums, and beyond giving me sort of a antibacterial thing, he said, well, try the ozone for a while.
Right.
The antibacterial thing helped, but then the ozone finished it off because I had no more bleeding. Ozone water, and it's tasteless, and it feels good.
Right. Right, Zach? Let's see, did I miss anything here? No, so I have a minute for questions?
You have about 5 minutes for
5
questions.
minutes, okay.
Yeah.
Any questions?